Hello once again and welcome to Clinic Annex. I'm Dr. Bosede Adigbite. I'm a consultant family physician. Today we'll be talking about prevention of sudden death, and it is in response to a request by a Clinic Annex fan. In recent times, reports and news of sudden deaths among friends, family members, acquaintances, colleagues have become common, leaving families, communities, and sometimes an entire nation devastated. It is not just happening in developing countries, it is happening across the globe and in different age groups. What can we do about it? First of all, sudden death means unexpected death from natural causes that happens within an hour of onset of symptom. From the time that that person says, "Oh, my chest," or "Ah, my head," to dying or being declared dead, it takes just 1 hour if that death is witnessed. But if the death is not witnessed, it is death within 24 hours of a person you have seen alive and well in the previous 24 hours. So somebody will say, "Oh, but I saw him yesterday. Oh, but I saw her yesterday." Yes, that is sudden death. We are not talking about death from road traffic accidents, suicide, drowning, or electrocution, but those from natural causes. Before we proceed, let me make it clear that it is not all causes of sudden death that can be prevented. But as humans, we will only do what we can and leave the rest. But what we can do will go a long way in reducing the frequency of sudden death. The commonest cause of sudden death are those that are related to the heart and blood vessels. Things like heart attack or cardiomyopathy, heart muscle disease, or coronary artery disease, where the blood vessels that supply blood to the heart itself are narrowed, they become narrow through atherosclerosis or excess cholesterol in the blood. It can also be irregular heartbeat. Sometimes you feel that your heart is beating irregularly. It is something that is serious or potentially serious. It can also be hypertension. Hypertension is a very common cause. People with very high blood pressure, 200, 250, over 120, sometimes have no symptom at all. And so they are just walking around. But yet, that is a ticking time bomb. Also, bleeding into the brain from stroke. We call it hemorrhagic stroke, which is closely related to high blood pressure also. Other causes are diabetes, severe asthma, epilepsy, or severe allergies, in which somebody reacts badly to some drugs or some food. Some people cannot take seafood. If they eat prawn or shrimps, they can have severe allergies that can take their lives immediately. Or even those that take illicit or illegal drugs, drugs of addiction, drugs that are not bought at pharmacies, but at black markets. They can have idiosyncratic reactions, unexpected reactions to these drugs, and die immediately. Also, carbon monoxide poisoning, where people put, generators in their living space. Entire families have been wiped out because they inhale the exhaust fumes from the generator and then they die in their sleep. These are some of the causes of sudden death. And we cannot exhaust the causes in this short video, but those that we have talked about, what can we do about them? So let us talk about some 4 figures that must be right to prevent sudden death across the board. Number 1, your blood cholesterol must be normal. Your blood pressure must be normal. Your blood sugar must be normal. And your body mass index, which is your weight across your height, must be normal. So we want to avoid obesity or overweight. Check with your doctor these 4 parameters. If they are not normal, please do something about them urgently. What are those habits that should be avoided? Habits that should be avoided are: number 1, overdosing on prescription medications. The doctor has prescribed 2 per time, but the way that thing is happening to you, you think 2 will not be sufficient, so you took 4. That is one thing that can cause sudden death that should be avoided. Number two, avoid taking of illegal drugs. You see, those that introduce others to illegal drugs might not have uh, reacted or responded in the way that these their recruits will respond. So you that you have been given this drug to take, by the time you take it, you might have an unexpected response or an idiosyncratic response that will even shock those that are giving you the drug. So avoid taking illegal drugs, please. Also, let's avoid putting generators in our living space. Put it in the open where it will not, the film from the exhaust will not get to you in any way. Number four, avoid smoking. Smoking is a risk factor for everything. And please, if you choose to use alcohol, then use it moderately. It is important to limit the amount of alcohol that is taken. You see, all of these substances, alcohol, nicotine, illegal drugs, all of these substances can be directly toxic to the heart muscles. So we don't want to take them, or we want to limit the use of alcohol if we choose to take alcohol. Number five, stress kills faster than anyone can imagine. So avoid stress. Take away your stressors. And one good way of dealing with stress is sleeping. Please, everyone should target 7 to 8 hours of sleep every day. Number six, stop ignoring warning signs. These warning signs are often there, but people say, oh, I'll manage, or they ignore them. And what are they? Chest pain. Don't ignore chest pain in any way. When your doctor tells you it is musculoskeletal, then you can ignore it or use painkillers. But be sure that it is not from your heart. So don't ignore chest pain. Don't ignore fainting or dizziness. Of course, not on days that you have not taken breakfast. Be sure to have taken breakfast first before you label dizziness a red flag. So dizziness, fainting, shortness of breath, or feeling, irregular heartbeat. Don't ignore all of these signs. Or weakness of one side of your body. It can be reversed. It can be stroke in evolution, stroke that is just starting, or funny sensation on one side of your body. If it can be stroke that is just starting, and that is reversible within 24 hours. But that is if you do the right thing within 24 hours. If you don't do the right thing within 24 hours, it can proceed and become complete stroke. So these are the things, the habits that we should avoid. What are the habits that we should promote, or the things that we should do? Number one is everybody should get a medical checkup. If you are not sick, go to your doctor and get a medical checkup. Even let them just check your BP, your blood sugar, your cholesterol, and your weight. If that is all you are going to do, it is okay. And sometimes your doctor might be able to calculate your 10-year risk of developing heart attack and stroke. We call it cardiac risk assessment. Number two is if there is an existing medical condition, please take care of it. Do not ignore it. Ensure that you take your medications, you do follow up, go to clinic, do follow up with your doctor so you can ensure you have been doing the right things. If you have allergy, go around with your EpiPen. If you are asthmatic, go around with your inhaler. It is important. It can save your life. Other things to do are eat healthy and maintain a healthy weight. Wear a medical alert device if you have a medical condition that might result in an emergency. If you have diabetes, for example, you might wear a wristband that talks about your diabetes. Or if you have a heart condition, you might wear a badge that shows that you have that condition so that whoever is around can know what to do. Or even a doctor might know what they are dealing with immediately. All of us should learn how to do CPR. It is not only medical professionals that should learn how to do CPR. You may watch videos like this one, or you may go for a paid training. Yes, enroll for a training. It's about 1 day. Usually, you are taught just within a day and you are done. Everybody should learn how to do CPR. It can save our lives. You can save the next person. Of course, sometimes after even the best CPR in the best hands, a patient might still not survive, but a lot more will survive if CPR is performed on them. So let us all learn to do a CPR. Thanks for watching. This is Dr. Abosedi Adigbite of Clinic Annex. I hope you liked it. Please give us a thumbs up, share with everybody. Let's save lives together. Everybody needs to see this. and put your comments or your questions in the comment section or on the WhatsApp number showing on your screen. I'll make an attempt to answer them. Please subscribe to the channel, turn on notifications so you get to see all the videos that are uploaded. And do not forget, good health is great wealth. We will not take it for granted. I'll see you in my next video, God willing. Until then, please be safe. Bye for now.